My name is Sylvia Khamati. I am the Head of Health and Social Services for the Kenya Red Cross Society.
Hello Sylvia, very good to meet you.
Thank you.
Tell me something about the burden of non-communicable diseases in Kenya.
In the recent study that was done, the stepwise survey for the country, it actually showed that we are having an increasing trend of non-communicable diseases, with the disease accounting for 50% of inpatient admissions in the country and close to 40% of hospital deaths in the country.
Wow.
So that actually is an alarming figure for a country that is still struggling with what we call the communicable diseases.
Right.
So we're having a double burden of disease in the country.
And do you see these diseases mostly in men or women, or is it equally distributed?
It's kind of equally distributed, but some of them are more in women, others are more in men, so it depends on the kind of NCD we're talking about.
Okay, so we're talking about things like breast cancer, diabetes.
Yes.
What else do you see?
Cardiovascular diseases
Okay.
are actually number one in the country.
Yes.
Then we have cancers are number two, mostly prostate and breast cancer. And then we have diabetes, and then we have a bit of other cardiopulmonary diseases also.
You see these in well-to-do Kenyans as well as poor Kenyans, or is there
Yes, it's a mix.
Okay.
It's a mix.
Right.
Yes.
So what happens? People pay their own insurance, so they pay their own hospital costs. Is this catastrophic for families?
It is. Actually, the NCDs have a very heavy economic burden on the families, because currently the healthcare system is the one that people still pay for their own health services at cost. So you get, mostly it's either through NHIF, or at times people just pay out of pocket payments to get treatment.
Okay, and I imagine with non-communicable diseases, this is a long treatment.
Yes, it's lifelong
schedule.
treatment. Yes, it's lifelong treatment. It has got, of course, a heavy burden to the families.
What does the Novartis Access partnership mean to you?
It means a lot. It came with a fresh air of breath, because we were looking at a country that was having, as I said, a very heavy burden of non-communicable diseases, and access to treatment was extremely difficult because of the cost that goes into that. So with the Access program, we are able to have people accessing treatment at affordable rates, and they are able to get their treatment when they need it.
Okay.
Yes.
Have there been challenges implementing the partnership? It's all gone smoothly? How's it been?
It has just begun, and of course, at the starting stage, of course, you'd have a slow start because partners are still understanding how it should go. But we are hoping it should go on well, because it's just begun.
Okay. Are you just in Nairobi, or are you all around the country? What's your geographic?
For Kenya Red Cross Access Program, we are doing it in the refugee populations.
Yes.
We are starting off in Dadaab, and then we will go to Kakuma.
Okay.
But we are also supporting Nairobi, which is the main, city in the country, and we are also looking at going to a few more other cities in the country.
Okay, so now with the prospect of Dadaab being closed, what does that mean for your plans?
Yeah, I think it means two things. It means, one, we still have the population there, as much as the government is talking about closing it. So we still need to provide service until the actual repatriation is done for the population. But also there are those refugees that have been reintegrated back into the Kenyan population that would still need services at the end of the day.
Okay.
And then we still have Kakuma that is running. Yes.
What is your message for WHO? What should WHO be doing in this area?
I think number one is to ensure that we have affordable treatment to the people who are suffering from NCDs. And number two, as a humanitarian actor, we need a serious discussion around NCDs in humanitarian crisis, because there are no guidelines, there are no standards, and there are no equipment or tools to be used during this. And we are right now responding to populations that are having very high burdens of NCDs, and during emergencies we do not have this considered.
Thank you very much.
Thank you.